This is Melanie Eisen with the Sullivan County Anti-Drug Coalition, and you are watching Prevention Saves. Thank you for joining us today. We have a special guest today. I want to introduce Toni Swavely. She is the tobacco coordinator for the Sullivan County Regional Health Department. Her office is located in Blountville, and we are going to talk today about tobacco prevention and everything that the health department is doing, everything that they're working on that is centered around prevention and cessation of tobacco. We want to help our community become a lot healthier, and so we're going to talk to her a lot about what they're doing to help with tobacco prevention. So hello Toni, how are you today?
Hey Melanie, I'm great. How are you?
Good, good. So I wanted to ask you about the different, I know you've got lots of different programs that you guys are doing at the health department, wonderful, successful programs. So I wanted to talk to you about each of those programs, and so that you can tell everybody about them, what they can get at the health department with these programs, and how it helps save lives and works with prevention. So I know the first thing that you guys want, I'll just let you kind of introduce each program, and then we'll delve a little deeper into each one. So
okay.
Take it away.
Well, we are extremely busy at the health department as far as tobacco prevention goes. We have numerous programs and initiatives that we're working on. Our main one that I'm really excited about is the Baby and Me Tobacco Free program, and that helps smoking pregnant women quit smoking during their pregnancy, all the way up until hopefully 12 months after the baby is born. And the great thing about this program is that when the mom signs up, she finds out she's pregnant, she signs up, she gets 4 prenatal visits and then 12 visits once each month after the baby is born. And so with those visits, if she blows under the limit, proven that she's tobacco free, then she gets a $25 voucher for diapers.
Oh, wow.
And also, if she lives with someone, could be a partner, a parent, a grandparent, whoever lives with her who also smokes and would like to try to quit with her, then they can sign up for the program and she gets another $25 voucher for diapers as long as they are also smoke-free.
Okay, so they go to the health department to do this?
Yes.
Okay.
So we've got it in Blountville and in Kingsport offices.
Okay.
So
that's great.
yeah.
Now, when you talk about blowing, what does that entail? Exactly, what does that mean?
We have a CO monitor which
Okay.
measures the level of carbon monoxide in the blood.
Oh, wow. Okay.
And, you know, if you're smoking, then your carbon monoxide level is going to be higher than normal. So.
Okay, all right. So that kind of proves that they're not smoking then.
Right.
And why is this important for moms not to smoke while they're pregnant?
This helps reduce the number of low birth weight babies and
Okay.
premature babies. It also improves the health of the mother.
Okay.
And for the 12 months after delivery,
Mm-hmm.
it helps reduce exposure to the child from secondhand smoke, which can harm their developing lungs.
Okay, all right. And I've also heard that when you have young children were exposed to cigarette smoke, it hurts their immune system, causes more ear problems,
Yes.
earaches, and that sort of thing, more asthma problems.
Right. It can exacerbate any asthma that they already have, or it can actually cause asthma.
Oh, wow.
So that reduces emergency room visits for asthmatic patients as well. And also, you're right, the ear infections are more frequent in babies whose moms smoke.
Yeah, that can be very troublesome for little ones.
Right.
All right. Well, that sounds really interesting. So, how do people? How do they? If they're found out they're pregnant and they're still smoking, what do they do at that point?
So you can just call the health department and then request to join the Baby and Me program, and we'll
Okay.
set you up an appointment. You can come in the next day.
Okay, and it's all free.
It's all free.
That's great. That's fantastic. So, all right, that sounds fantastic. So, tell us about other programs you guys got going on.
Well, another program that we have that's designed to reduce exposure to secondhand smoke is the Gold Sneaker Initiative,
Oh.
and that is a certification process for daycares. to certify them as non-smoking facilities. And it also, they have to abide by policies regarding physical activity and nutrition.
Oh, wow.
So it's a well-rounded program, and all the daycare has to do is take a course. We offer like a one-day course on the program, and they have to do some paperwork and then put those policies into place in their program. They get listed on the Tennessee State Health Department's website as a Gold Sneaker certified facility.
Okay, all right, that sounds great. And so moms and dads want to look for that,
Right.
That certification when they sign their children up for daycare, don't they?
Yes, that's important.
Yeah, that's really interesting. And I know that you have the Unsmokable program.
Yes, that one is probably my favorite because it's a big program. We go into the schools and we do tobacco education, and we've also added in an interactive, animated education towards e-cigarettes and vapes with that. We also do signage projects where we ask for, or we give signage for smoke-free zones within the city, mostly around where our children are.
Okay.
So we just want to really reduce that exposure to secondhand smoke, and also this helps prevent our kids from initiating tobacco use when we go into the school and do the tobacco education.
Okay. So why is that important at this young age? Not using, especially the e-cigarettes, because that seems to be what the younger people are attracted to at this moment in time. Not necessarily smoking cigarettes, but those e-cigarettes. So why is that important to
Well,
keep them?
our cigarette use is still higher than state average, but it's dropping. But what we're seeing is that e-cigarette usage is rising. So people are, they believe that e-cigarettes might be healthier than regular cigarettes, but we just don't know that that's true. So we can't say that e-cigarettes are healthy because there's no research. There's not a lot of research around that.
Right.
So the thing about cigarette usage as well as e-cigarette usage is 90% or 95% of the people who smoke as adults started before they were 18.
Oh, wow.
Yeah. And 99% of people who smoke as adults started before they were age 25. So smoking begins in youth.
And we all know somebody, if not ourselves, who have had a hard time quitting. So
Right.
everybody struggles, so it's good not to ever start, right?
Right. Nicotine is addictive. And the thing with e-cigarettes is it's not a water vapor, it's an aerosol. And the difference between water vapor is what comes off of a boiling pot of water or a steam iron. But aerosol is what comes out of a hairspray can. So there's solid particulate matter that does get into the lungs, and we know that that is going to cause some kind of damage to the lungs.
Yeah.
We just don't know what and to what extent.
Yeah, you wouldn't want to be breathing hairspray, so right, that sounds awful.
Yeah.
Well, that sounds very important, and I know that a lot of the kids in the area have been carrying water bottles and all kinds of interesting stuff, and the Instagram feed around Unsmokable. It's a really exciting program. I like seeing it.
Unsmokable is the first program to communicate a public health message to youth through social media.
Oh, wow.
Yeah, so all the kids have to do is go to unsmokable.com. They get some tobacco education on our website. There's also a section for teachers and a curriculum that they can use in the classroom.
Oh, wow, that's really good.
Yeah, and it comes in color or black and white.
So they can print cheap.
And so then the kids go to our social media outlets, which we're on Instagram, Facebook, Tumblr, and Twitter, and they can participate in contests and win prizes.
That's really awesome, and I've seen that it's been carried across the state. So that came from Sullivan County Health Department, and now there are other
there are a couple other counties that have adopted it.
Yeah, that's really exciting.
Yeah.
I really think that you all have done a fantastic job with that. So.
Yeah.
Very, very nice.
Thank you.
Well, is there anything else that you would like to share and tell our watchers that is important to know about tobacco prevention and cessation?
Just that the earlier that you start with tobacco education, the better, because we've seen kids as young as 8 or 9 years old start smoking.
Yeah.
So we really just emphasize to teach your kids how dangerous tobacco is. It's the #1 preventable cause of death.
Yeah.
So.
Well, all right, that sounds great. Well, I really appreciate Tony coming to talk to us today about what the health department is doing and about tobacco in our community. And I want to thank you guys for watching, and I hope to see you again soon. Thank you.